Okay, I'm Jake. I'm the PA that's going to be talking to you today. So why don't you go ahead and tell me what's been going on?
So about like a 2 or 3 weeks ago, I started noticing like a little bit of like my heart palpitating, and it kind of caught me off guard. And I noticed a little bit before that I was getting a little short of breath when I would try and like exercise and stuff like that.
Okay.
So I just wanted to come in and make sure it's all good.
Okay. Well, first off, I'm sorry to hear that, and I'm going to do everything I can to make sure that we kind of like get you back on track and back to a good state of health. Okay. So starting with your heart palpitations, like when does those happen constantly throughout the day or specific?
They're kind of intermittent. I haven't noticed like a good pattern with them,
Okay.
but just more if I exercise, that's when I get a short of breath.
Okay.
But the palpitations themselves have kind of been kind of sporadic, I would say.
Does the palpitation start before your shortness of breath?
Yes.
Okay. So you would say kind of like with exertion on the palpitations too, or?
I don't know if I'll do that because I get the palpitations when I'm at rest as well.
Okay. So you get when did it exactly start? I know you said 2 to 3 weeks ago. Was there a specific event?
I don't think so. I was at like my son's game and I felt like a little bit of like this like weird feeling in my chest. That doesn't feel normal, and then it kept happening.
Okay.
Intermittently throughout the weeks.
Does anything make it better?
When I rest, but they can still happen then, but they happen less frequently, I would say.
Okay. And you said exertion makes them worse.
Yeah, it makes the shortness of breath worse too.
Now with your exertion, like what type of exertion? Like exercise or just
I
like
would
getting
try
up?
and like go for runs here and there because I had a heart attack like 5 years ago. And I was
Okay.
kind of young, so I was like, I have to get back in shape. My kids are young.
Okay. Okay. So is there any changes as far as from 2 to 3 weeks ago with the palpitations to now? Are they happening
Nah,
more?
they've been about the same, I'd say.
Okay. Has this ever happened to you before?
The palpitations,
Yeah.
no.
Does the palpitations give you any type of chest pain?
I do have some chest pain, yeah.
Okay. Does the chest pain stay in one spot or?
It's kind of like over here,
Okay.
but it doesn't seem to be like affected by when I breathe. It's just
Okay.
kind of like pain itself.
Okay. With the palpitations, as far as they're interfering with your everyday life, scale of 1 to 10, 10 being the worst.
I'd say about like a 4. It's more just like that exercise thing. Like I can still kind of do what I have to do.
All right, so now we're going to kind of talk about the shortness of breath. So that's only with exertion, you said?
Mostly, yeah. If I like when I would try and go on the run, I would say, but now I'm even saying it if like me and my wife go on a walk that
Okay.
by the end of it, I'm starting to get a little like out of breath.
Has the shortness of breath been present for the entire 2 to 3 weeks?
Yeah, it started about maybe 2 or 3 days afterwards.
Okay. Does what makes the shortness of breath better or worse?
When I rest, kind of makes it better, and then the more I exert, the more likely I think I am to suffer from it.
Has the shortness of breath increased over the duration of the 3 weeks or has it stayed the same?
Probably stayed about the same.
Okay. Has the shortness of breath with the palpitations ever happened before prior to today?
No.
Okay. On a scale of 1 to 10, when you're exerting shortness of breath, how much does it interfere with the activity?
Probably about an 8 or a 9.
Okay. Point to the chest that you feel most tight. So right in the center. Have you noticed anything else going on?
I don't think so. I was just worried because I had the heart attack, so I was kind of like, I take a Cetrapil for that, I think it's called, something like that. I take 25 milligrams a day.
Cetrapil?
Something like that.
Okay, 25 milligrams. Every day?
Yeah, once a day.
And it's just a pill?
Yep.
Do you have any allergies?
Nah.
All right, so I'm kind of going to focus on your palpitations for right now. So you said you had heart trouble in the past, as in 5 years ago you had a heart attack?
Yes.
Okay. Do you have any high blood pressure?
Not that I know of.
Have you ever had any instance of rheumatic fever?
No.
Do you have any instance of heart murmurs?
Not really, just the palpitations, I guess.
Okay. Do you have to use pillows at night to get to sleep?
I do a little bit. I kind of try and prop myself up, feel a little more comfortable.
Do you just like propping yourself up, or do you need to sit up all the way?
I don't have to sit up all the way.
Have you noticed any swelling in your hands, ankles, or feet?
Not that I've noticed.
When was your last EKG?
Probably about a year ago.
Okay. Was anything abnormal about it?
No.
Okay. Real quick, I'm just going to go over your shortness of breath right quick. So have you been coughing?
More of a cough after like I do something, so it's not like the cough's there all the time.
Okay.
It's there like after I would say exert myself.
Is there any sputum associated with the cough?
No.
Have you noticed any wheezing?
No.
Do you have pain with deep breathing?
No, more just like chest pain itself.
Okay. Did you have the chest X-ray anytime? Last X-ray? Last chest X-ray?
Not that I can recall.
Do you have any asthma?
No.
Bronchitis?
Nope.
Emphysema?
Nope.
Pneumonia?
No.
Any instance of tuberculosis?
No.
Okay. Do you have any trouble swallowing?
No.
Do you have any intermittent heartburn?
Yeah, but I feel like that's probably more from what I eat.
Okay. Do you have a normal appetite?
Yes.
Okay. Any nausea?
Maybe a little bit of nausea over the past couple weeks, but nothing like too crazy.
Do you have normal bowel movements?
I think so, yeah.
Do you have normal stool color and size?
Yes.
Do you have any changes in your bowel habits recently?
Not that I've noticed.
Okay. Any pain with defecation?
Nope.
Have you noticed any bleeding or black tarry stool?
Not that I've noticed that.
Okay. Any hemorrhoids, constipation, or diarrhea?
Nah.
Okay. What about abdominal pain in general?
No. Or just the chest.
What about food intolerance, excessive belching, or passing of gas?
Nope.
Jaundice?
Nope.
Liver or gallbladder trouble?
Nope.
Hepatitis?
No.
Okay, great. And then real quick, did you notice any intermittent leg pain with exertion while you were having any?
No leg pain.
What about cramps?
No cramps.
Do you have varicose veins in the past?
No.
Do you have any swelling in your lower extremities?
Yes.
Okay. What about color change in fingertips or toes?
Nope.
Okay. And any swelling or redness or tenderness anywhere?
No.
Okay. Great. One second, just writing some notes.
No problem.
All right. Did you smoke at all?
I smoked when I was like about 20 to 25. I smoked about half a pack a day, but I quit after I had my kids.
Okay. So 20 to 25, half pack a day. Any alcohol intake?
Yeah, I like to drink.
Okay. So tell me about what's normal for you.
I'd say about a case a week.
Okay. Case being?
It's like 24 to 30 beers.
Okay. About on a nightly basis, or is this just like?
More on the weekends.
Okay. Okay. So tell me about your family history of heart problems, specifically mom and dad.
Mom and dad. Well, dad passed away. He died of a heart attack. He died let's see, like 63 at the time.
Okay.
But mom has no heart problems.
Okay. Does your dad have any hypertension, high cholesterol?
He had AFib.
Okay. Are your kids healthy?
Yeah, they're both doing well.
How old are your kids?
One's 13 and
Boy, girl?
the boy's 13, the girl's 10.
Yeah, I'm just going to kind of circle back to your childhood illnesses and immunizations.
Yep.
Did you ever have any instances as a child of measles?
No.
Mumps?
Nope.
Chickenpox?
No.
Rheumatic fever?
Nope.
Scarlet fever?
Nope.
Polio?
Nope.
Psychiatric disorders?
No.
And as far as immunizations go, did you receive polio?
Yes.
MMR?
Yes.
Hepatitis B?
Yes.
Rotavirus?
Yep.
Diphtheria?
Yep.
DPT?
Yes.
Chickenpox?
Yes.
Tetanus?
Yes.
And pneumococcal?
Yes.
As far as, I'm just going to list some adult illnesses, just tell me whether you have them.
Okay.
Okay. Thyroid?
No.
You said you have heart problems.
Yes.
Hypertension?
No.
Hyperlipidemia?
No.
Diabetes?
No.
COPD or asthma?
No.
Cancer?
No.
HIV?
Nope.
Hepatitis?
Nope.
Kidney disease?
No.
Blood clots?
No.
Psychiatric history?
No.
Okay. And as far as your immunizations of recent past, have you get a flu vaccine?
Yes.
Hep B?
Yes.
Zoster?
Yep.
And pneumococcal?
Yes.
Okay. Am I 5 years ago? Did they do a bypass for your heart attack, or tell me what they did as far as interventions?
I think they gave me a bypass.
Okay. Was there any complications with your coronary bypass?
Not that I know of. Now I'm starting to just problems, so
Okay.
hopefully nothing.
Have you ever had any accidents or injuries in the past that required surgery?
No.
So what hospital did you go to for your heart attack?
Jefferson.
Okay. And I'll say 5 years ago. Okay. Any specific surgeries outside of the coronary bypass graft?
No.
Okay, great. I'm just going to ask you about some health maintenance screenings. You ever had a colonoscopy?
No. I think I'm getting close to that age.
Okay. When was your last prostate or testicular exam?
I guess the last time I went to the doctor,
Okay.
about a year ago.
Okay. Ever had a DEXA scan?
What's that?
Like assesses your like body composition.
Nah.
Okay. TB screening?
Yeah.
Okay. When was your last one for that?
About 2 years ago, we'll say.
Okay. Cholesterol check?
Yeah. Let's do that.
When was that?
About a year ago, I think.
Okay. Fecal blood test?
No.
Lung cancer screening?
No.
Okay. All right, so we have family history of, one second, I'm going to try to ask these questions twice. Heart disease. And then I'm just going to ask specifically some specific stuff that's been involved in your family, specifically looking at your parents, grandparents, and kids. Okay.
Sounds good.
Any history of headaches?
No.
Seizures?
Nope.
Stroke?
I think my grandpa had one.
Okay.
But all my grandparents are dead now.
Okay. Mental illness?
No.
Suicide?
Nope.
Substance abuse?
Nope.
Thyroid disease?
Nope.
Any other heart disease?
Nah, just me and my dad.
Okay. Hypertension?
My one brother
Okay.
suffered a little bit from hypertension.
Hyperlipidemia?
No.
How old's your brother?
He's about 52.
Diabetes?
No.
Asthma?
Nope.
Tuberculosis?
No.
Renal disease?
Nah.
Arthritis?
Nah.
Allergies?
Nope.
Cancer?
My mom had breast cancer, but she got through that.
Okay. Is your mom still living?
Yes.
And how old is she?
What's she now? 82?
Okay. And genetically transmitted disease?
No.
So I'm just going to kind of ask you some general stuff, unrelated, not necessarily unrelated, but just about yourself, just so I get a better idea.
Okay.
So where were you born?
I was born in Philadelphia.
Okay. What's your perception of your childhood?
It was good. I mean, I was a little younger than my brother, so sometimes picked me, but I had a good childhood.
What was your last year of schooling?
Graduated high school, whenever that was. So high school.
Okay, no worries. What do you do for work?
I'm a painter.
When do you think you're going to be able to retire?
What am I now? 46. Hopefully by the time I'm 66.
All right. Tell me about your home situation. Who lives in your house?
It's just me, my wife, and the 2 kids.
What gender would you identify your wife as?
She's a female or a woman.
Okay. How long have you guys been married?
About 16 years now.
Okay. Congratulations.
Thank you.
What would you say is your primary source of stress?
Right now, probably this problem, but before it was just making sure I get back in shape after the heart attack.
Okay. Do you have any military history?
No.
How would you describe your financial situation?
Good.
Okay. What do you like to do for leisure?
Big Eagles and Sixers fan.
Okay.
Go to my kids' games.
Is there anything that you do with your regular everyday activity that you struggle with?
Right now, no. Just the exercise.
Do you have any religion or spiritual beliefs?
I'm Catholic, but not practicing.
Okay. You say you try to exercise, but here lately it's been.
Yeah, I was kind of lazy before the heart attack. I let things get out of hand, and then after that, I got myself back. But now I'm struggling with this.
All right. So tell me about your normal food intake for the day.
My wife cooks a lot, so
Okay.
she tries to keep me on track. So I would say it's like a balanced diet.
Okay. How much caffeine are you drinking?
I usually have a cup of coffee in the morning.
Do you feel like you're getting enough sleep?
Yeah,
How much is a normal night for you?
probably about 6 to 7 hours.
Okay. Are you, in the instance of you're in the car, do you wear a seatbelt?
Yeah,
You wear a bike helmet?
I haven't rode a bike in 30 years.
Sunblock?
Yeah.
You have smoke detectors in your home?
Yep.
And do you lock cabinets for meds or chemicals? Do you practice any alternative healthcare practices? Okay. Any new sexual partners in the last 6 months?
Nah, just me and my wife.
Do you have any partner violence, emotional, physical with your wife?
Nah, we're both pretty good, I think.
All right, I'm about to ask you a ton of questions, and just bear with me. We'll try to get through them. All right?
Yep, no problem.
Have you been your usual weight?
Yes.
Any recent changes in how your clothes fit or not?
I think they've all been good.
Okay. Any notice of weakness, fatigue, or fever?
Just the fatigue when I get like short of breath after.
Okay. No problem. But you don't feel like your muscles can't perform the function.
No,
It's just that you're tired.
Yeah,
Okay.
those are good.
Regarding your skin, have you noticed any new rashes, lumps, sores, or itching?
No.
What about dryness?
No.
Okay. Have you noticed any color change in any existing moles, nails, or just general skin color?
Nope.
Okay. Have you noticed any recent headaches?
I wouldn't call it a headache. I would say like more like a lightheadedness thing.
Okay. Okay.
And I started about the same time, but it's not as big of a concern for me as the other
Any
thing.
associated dizziness with that?
Maybe a little bit of dizziness, but
Okay. But no specific like head injury causing that. So
No.
head trauma.
no head trauma.
Okay. What about your vision? Has it everything?
Yeah, it's actually good.
Do you wear glasses or contacts?
No.
Okay. When was your last eye exam?
About 2-3 years ago.
Okay. Have you noticed any pain, redness, or excessive tearing?
No.
Double or blurred vision?
Nope.
What about spots, specks, flashing lights?
No.
Any history of glaucoma or cataracts?
Not that I know of.
Is your hearing been baseline for you?
Yes.
Okay. Any history, any problems with tinnitus?
No.
Any problems in the past with vertigo or earaches?
No.
Okay. What about any recent ear infections, discharge?
No.
And do you use hearing aids?
I do not.
Okay. Going on to nose and sinus. Do you experience frequent colds, stuffiness?
No.
Okay. What about discharge or itching?
No.
Hay fever?
Nope.
Nosebleeds or sinus trouble in general?
No.
Okay. How would you describe the condition of your teeth?
I don't think the smoking that I did before hurt them that bad, so I'd say they're in good shape.
Have you noticed any intermittent bleeding?
No.
Do you wear dentures?
I do not.
When was your last dental exam?
About 6 months ago.
Okay. Have you noticed a sore tongue, dry mouth, or frequent sore throats?
No.
Any hoarseness?
Nope.
Okay. On your neck, have you noticed of any swollen glands or lumps?
No.
Pain?
Nope.
Stiffness?
Nope.
Or any goiter, which is like an enlarged?
No.
Okay. On your breast, do you notice any lumps, pain, or discharge?
I haven't checked.
No problem. So we don't do self-exam.
I'll have to start doing that.
Yeah. Any discomfort around the general area?
Just that like chest pain
Okay.
I was saying before.
Going to the bathroom. Frequency of urination been the same?
Yes.
Do you notice going to the bathroom any more often at night?
Nah.
Okay. Any urgency if you're not going to make it?
Nope. Been the same.
Okay. Any burning with urination or pain?
Nope.
Okay. Any blood in your urine?
No.
Have you had urinary infections in the past?
No.
Okay. Do you notice any kidney or flank pain?
Nope.
Do you notice any pain above your penis?
No.
Okay. And do you have any incontinence?
Nope.
What about force of string being normal, abnormal?
I'm good.
Okay. Any hesitancy or dribbling when peeing?
Nah.
Okay. All right. Have you had any hernias in the past?
No.
Okay. Do you notice any discharge or sores on your penis?
Nope.
Do you have any testicular pain or notice scrotal pain?
No, I haven't seen anything down there.
Okay. Do you have any history of STI?
No.
Any new sexual habits you're wanting to explore?
Nah, we keep it simple.
Have you noticed your sexual interest being the same or any changes with that?
It's been the same. A little bit more scared with the heart problem now.
Okay.
But still been about the same.
Everything's still working fine?
Yeah, down there is all good.
Okay. Do you feel satisfied?
Yeah.
Okay. Are you guys using any birth control methods?
Nah, I think she's close to menopause, so.
Okay. Do you guys use condoms?
Nah.
Do you have any problems or concerns about anything related to sexual health?
Nah, we're good.
Do you have any muscle or joint pain in general?
No.
Do you notice any stiffness, arthritis?
Nope.
Do you have gout?
I do not have gout.
Okay. Do you notice backache at any time?
No.
Do you notice any swelling, redness, or pain, tenderness, or stiffness related to any joint?
No.
I know that you said you were fatigued, but you don't notice any weakness with any type of motion?
Not in like the muscles, nah.
Okay. And timings of symptoms are, as far as your fatigue goes, is pretty
More
much
like after
Yeah.
exertion.
Okay. And duration is just whenever you come back to normal, come back to your baseline after the exertion?
Yeah.
Okay. Do you have any history of traumatic injuries?
Nah.
Okay. Do you notice any neck or low back pain?
Nope.
All right.
All good?
Yeah.
Sweet.
Dude, I tried it.